Good evening, everyone. We want to welcome you to our Tuesdays with the Doctor. My name is Elder Annette Barnes, and I want to welcome those who are on with us on Zoom tonight, as well as those who may be watching later. This evening, we have a special guest to talk to us about the cycle, the menstrual cycle, and we hope this will be helpful to you or for someone you know. Our speaker will give us a presentation and then take questions afterwards. And you can ask your questions either by unmuting yourself, putting your questions in the chat, or if you want to send a question anonymously, you can send a message directly to me and I will make sure that your question gets answered. So I would like to introduce our speaker tonight, Dr. Suzanne Mesidor. She is a fellow of the American College of Obstetricians and Gynecologists, the assistant clinical professor and OBGYN at Albany Medical College, Women's Health Champion, Albany Stratton VA Medical Center, Section Lead Gynecologist of the Women's Wellness Center. And she currently works at Albany Stratton Veterans Affairs Medical Center and Albany Medical Center. In 2007 through 2014, she worked at Columbia Memorial Hospital. In 2001, she graduated from Upstate Medical University in Syracuse. 2005, she obtained her residency in obstetrics and gynecology at the Rochester General Hospital, and her undergraduate degree is at Columbia University. So at this time, I would like to turn the time over to Dr. Mesidor to give us our presentation.
Hi, thanks so much for having me. Today, we're going to be talking about a very important topic that affects about at least half of our population, right? It affects women. We'll be talking about the menstrual cycle. So thank you so much for this invitation. It's been my passion to take care of women all these years. And I love, what I do, being an obstetrician and gynecologist. And I'm just going to go ahead and say it's great to be here, and I'm going to go ahead and share my screen. All right. So today we are going to talk about the menstrual cycle, okay? And it's pretty interesting. It causes a lot of consternation in some women and a lot of angst and a lot of concerns. So I'm going to just go ahead and dive right in. The important organ that's involved in this is the uterus. So I'm going to go ahead and introduce the uterus. I'm just going to put up a picture here of what a uterus might look like. Just a graphic presentation, a little drawing of it. So it's a pear-shaped organ that's located in the pelvis of women. So here's a little, cutout of the pelvis of women, a little drawing, and the uterus would be located right in the lower part of our pelvis, right in the lower part of, people would say, your lower part of your abdomen. And in pregnancy, it hosts the developing baby. So you have ovaries that are attached to both sides of the uterus, and in these ovaries, you have the eggs, which are stored and they're produced here, and they're released monthly in anticipation of fertilization. So when an egg is released, it travels down the fallopian tube to the uterus. And meanwhile, during the month, the uterus builds up a lining of blood right here. This is like the inside of a uterus that's kind of like cut away so that we could see what's going on. So builds up a lining of blood, tissue, and proteins to provide nourishment to a growing baby in case an egg is fertilized. So if an egg is not fertilized, the lining of the uterus, which has this blood buildup, sheds. Okay, so it's going to shed monthly. So when it's shedding, we experience this as our menses, when the blood is, being expelled, and this blood and lining that is being squeezed out, a lot of women experiences as cramping. You might get a monthly menstrual cycle, which manifests as sort of like cramping. So if an egg is fertilized, however, then the embryo and the growing baby would attach to the lining of the uterus, and it's going to be supplied with nutrients from the mom. All right. So as the baby grows and develops here inside the uterus, see, we have different representations of the uterus on this slide. This is where the baby would grow, right inside the uterus. It's going to be nourished by the mom. So why do we talk about the menstrual cycle? Well, it occurs in women, all right? And the more we learn about this menstrual cycle, we become educated as to what is going on in our bodies. So we are going to learn what is normal and what is a normal pattern of bleeding. So when these patterns become a little bit abnormal, you can realize that something is abnormal so that you can talk to your doctor about it. So when we are educated about our menstrual cycle, and this applies especially to a lot of young girls or even, young women, young ladies, then we'll be less anxious about what's going on in our bodies. We would know how to anticipate and kind of like gauge what our body's going through, especially because sometimes it can affect our moods too, okay? It can affect our moods, having all this, hormones go up and down in our bodies during the month. So when we discuss the menstrual cycle, we're not in the dark about it. We can be open about it. We can have less anxiety. We become educated, informed, and we'll also learn how much bleeding is normal and what is not normal. Okay, and we'll also get into like what type of feminine products we can use. And we're going to start to, I'd like to emphasize that you should start to track your menses either by using paper tracking or menstrual app and so on. So this is always important because whenever you go to the doctor, especially a gynecologist, or if you went to the emergency room or your internal medicine doctor, any kind of doctor, if you're a woman, they always want to know when was your last menstrual period. And so it's important for us to keep track of that, okay? So here is a little representation of when the blood and the tissue lining builds up every month. And when fertilization does not occur and an implantation of a baby does not occur, the lining sheds and there's bleeding that occurs. Now, I want you to know that there are lots and lots of slang words for menses, okay? People will say periods, I have my periods, or they would say stuff like Aunt Flo, the Red Sea, having a monthly visitor, Mother Nature is happening, or the red moon. But when you all count it up, there's over 5,000 different words in many different cultures about words for menses and what that means, okay? So sometimes it's just like what your mom has taught you to call the menses, or, but that monthly bleeding that a woman starts in puberty, a lot of people say periods or menses, okay? So what is puberty? When does these things all start to happen? All righty, let's go on to the next slide. Well, for one thing, menses is a sign that your body is growing and it's changing, all right, as it prepares itself to become pregnant one day. And this transition happens when we're going from childhood to an adulthood. So when it's part of our normal development of puberty, okay? So puberty starts when we are, about some people 9, 10, or 11, all right? And it is triggered by different hormones that we have in our body, okay? So these different hormones, like for example, estrogen and progesterone in girls, these play a very important part in triggering and facilitating this sexual maturity as our bodies develop and become more adult-like, okay? But guess what? This goes on without us knowing it, all right? So this is something that a lot of girls, you can't control. It just happens. So it gets triggered, and we'll talk about what triggers it. and you have no control about it. You have no control about this. So when we say that the menstrual cycle is cyclical, it means that it comes and it goes on a monthly basis. So the menstrual cycle, we count it from the first day that you have your period to the first day of the next period when it starts. So when you count the days in between, that is what we consider a cycle. There are lots of apps and stuff that makes it easier for us to, very easy for us to monitor this, but we'll get into that a little bit later, okay? So you might be wondering, what is puberty? When does this change get triggered in our bodies, okay? So I have like a little chart here that shows us the stages of development that we all go through. It's just a little drawing. And these are the stages. They're called Tanner stages. Stages 1, 2, 3, 4, and 5. Okay. So we could see that when Tanner, when you're in this stage 1, this happens in children. These are children who have not gone through puberty as yet. When you start seeing there's a little bit of breast growth, they call it breast budding, then you know that puberty has started, okay? You might get a little bit of breast growth and a little bit of hair growth, but it all starts slowly. We have no control over this, but usually by age 13 or so, a lot of girls have started with the breast budding and some hair growth, okay? Now, you can get hair under your armpits. You can start developing acne. And as you get a little bit more mature, you will have something like your areola, the nipples will get a little bit bigger, like in this picture, a little bit more hair growth. And then definitely by adulthood, the breasts become have a little more contour in it, and there's more hair growth in the genital areas and under your armpits, okay? So we can see that this menstrual cycle, it starts in puberty, and on average, let's say, on average, it occurs, around age 12. Now, I know a lot of girls may have had this at 9 or 10 or 13 or 14, for example, but just like an average would be around 12 years old. Now, just so you know, a normal menstrual interval is anywhere between 21 to 45 days. So when you take an average of that, we say every month your period comes. But remember, it could be every 21 days from the first period this month to your first period of the following month. It could be 21 days to 45 days apart. It's all normal. And when you do bleed, you can have anywhere from 3 to 10 days of bleeding. So we usually just, round it out and say, you have about a week of bleeding, okay? And it's normal to use about 3 to 6 pads or tampons a day, okay? So let's talk a little bit about when does menses start? How long is it? Well, in the United States, it usually occurs, like I said before, between 12 and 13, but it can happen anywhere from 9 to 16 years old. And believe it or not, if people are well nourished, it can happen earlier, like around 9 or 10, or sometimes people who are poorly nourished, like in the refugee camps, or girls who are, very active and, burning a lot of calories, like in sports and vigorous sports, their menses can occur later, 14, 15, or even 16 years old. All right. So a good estimate is that by 98% of the girls by age 15 or so will have their periods. All righty. So cycle days, remember we discussed this before. I want you to just know that if your periods are 21 to 45 days apart, that's normal. So it's not so good to compare yourself to others or to your friends. Okay. And as you get older, your period might get shorter. It might change as you hit your teens, 20s, 30s, 40s. So it's never really going to be exactly the same unless it's hormonally controlled. So some women it's hormonally controlled with birth control pills or something, and it's a little more, it comes on a regular routine, but even that is not normal. It's controlled with hormones. All righty. So if you go about 90 days or so without, periods, for some girls that's common, but not for the majority of the population. All righty. So what triggers this? Well, you might be genetically predisposed to this. Okay, certain things like your nourishment, your environment, your socioeconomic condition, your access to good, healthy food, all right, and preventative medical care. And all that will trigger how healthy you are and how your body functions and when your periods start, all right? So what's going on with this? I'm going to show you a fancy chart here, and then I'll go over it with you, okay? So in a chart form, you can see that the menstrual cycle is broken up into two phases, the follicular phase and the luteal phase. And this is all controlled by hormones, the different hormones in our bodies. So remember, it's a monthly cycle of hormones. You have all sorts of fancy words: follicular stimulating hormone, FSH, luteinizing hormone, LH, estrogen, progesterone. They're all you were created that way. These are hormones that you have no control over. They're doing their thing in your body. All right. So every month, they work together. All these hormones work together in releasing an egg. Here you see, this is ovulation. An egg is released. All right. So women are born, or baby girls are born with thousands of these like little eggs that you're born with. You have them at birth, and when you hit puberty, that's when they start to be released. But all the eggs that you ever would have already present in a newborn baby girl. All righty. So a single egg is chosen from hundreds of thousands of these little oocytes, or baby, eggs or follicles that are located in your ovary. And what happens is the follicular phase. This is just a representation of bleeding, someone who is started their period. So the follicular phase begins when you start your menses, and then it ends on the day before you ovulate. All right. And then after ovulation, then you're going to have the buildup of the menstrual lining, buildup of the menstrual lining, and then you're going to shed it again. So this kind of like the cycle of shedding, bleeding, buildup of lining, and then shedding, it occurs monthly, and it's all hormonally controlled. All righty. So what are some symptoms that you may experience when you have your menses? Okay. Well, for one thing, a lot of people say that they feel cramps or bloating. All right. Some girls complain of lower back pain or some breast tenderness, abdominal or pelvic bloating, or, nausea, vomiting, even diarrhea, some girls. Now, remember, this is only a list. This seems like a lot of symptoms here that I have listed, but it could be more. It's like over 150 different symptoms that people can feel. So remember, you are not to compare yourself to others, because everyone experiences menses differently. And quite a good majority of girls don't have any symptoms. All right. So just consider yourself lucky if you don't have any symptoms. But some people may have like mood swings and irritability. Okay. And You might hear the term premenstrual syndrome or PMS. A lot of girls will say, oh, I'm so moody, I'm PMSing, meaning you're just so moody. You might feel like crying, or you might feel just get angry for no reason, or um, these are all just mood changes that can occur. A lot of people report, a lot of girls report food cravings where they feel, like they want to eat more um, chocolate or more sweets or more junk food. But you won't believe, if you actually ate a lot of healthy foods, this would reduce the amount of cravings that you have. Okay. So acne is a big sign that a lot of girls can experience during their menstrual period. Things like headache, you feeling more fatigue, and like you have to sleep more. And that's actually a clue that your body does need some more rest. So listen to your body when you have your menses and you feel more tired or more, achy and with cramps. Go to bed earlier. Okay. Remember that. Some people might experience trouble sleeping because of the cramps or so on, but heating pads are good. Things like Motrin or Aleve, naproxen is actually good too for like when you're having some cramps. So remember that. And you may experience that when you bleed, you may have, regular red blood, or sometimes little blood clots will come out on the pad. All right, during the menses. So, how much blood is lost during menses? It will surprise you to know that only about an ounce or 2 tablespoons of blood is lost during this time. I know, it sounds like a little bit when you say an ounce, but if you say 1 ounce or 30 milliliters, which is about an ounce, it's about 2 tablespoons of blood, and you leak it slowly over, 3 to 7 days or so. That's about normal. Now, if you have over 3 ounces of blood loss or 80 mLs, it can lead to you being anemic, right? Because you're just bleeding more per month than your body can handle, unless you start eating a lot of iron-rich foods and so on. All right. But when you're anemic, when we say that you're anemic, it means that the blood doesn't have enough red blood cells to carry oxygen through the body. So it has a reduced amount of oxygen floating around, and you might feel tired, dizzy, lightheaded, short of breath, and faint. So, but the question is, you're probably asking me, who can measure? The real question is, who can measure their blood loss, right? It's impossible to do. But a good estimate is that when you have heavy periods and you're changing like your pad every 1 to 2 hours and it's soaked, and this is going on for more than 7 days or so, that's considered excessive. All right. So you may not be able to measure it, but at least you have kind of like a something in your mind. If you're bleeding more and you're soaking through the pads every 1 to 2 hours and it's going on for more than a week, that's excessive. All righty. And you should speak to a doctor about it. Now, period products. Okay, we have a lot of period products that we're going to talk about tonight. And where do you get them? You get them at the pharmacies, grocery stores, Target, Walmart, Amazon, gas stations. Pretty much a lot of places they have them in order to make things convenient for women to buy them. All right. Even when you go camping and they have a little camp store, you might find them in there too. All right. This is just to make life easier for us. Okay. So when I'm going to go into like these products that we could use in detail. Okay. But these products that we use during our menses, basically, whether it's like a pad, a tampon, or a menstrual cup, these are things that we use to collect the blood and the tissue that comes out of our vagina during the period, right? So remember that tampons and menstrual cups cannot get stuck inside of you or get lost or move to another part of your body. The muscles in the vagina area holds them in place without you even knowing, and they stay there until you take them out. So a lot of times you can't feel them at all when they're in the right spot, and you can even wear them when you go swimming. So How do you know which one is good for you? Well, it all depends on what's comfortable for you to use and what do you want to use, all right? But I'd recommend if you're going to use tampons or pads, don't use the scented ones. Don't use any kind of vaginal douches or deodorants and stuff, because I see that they're having a lot of those advertised on TV, and they're marketing it to young people and to grown-ups too. So these products that you use, special douches or deodorants in your private areas, can cause irritation and infection. So if you worry about hygiene and the odor and the smell, remember to change the pad, tampon, or period panty, or cup very often, okay? So we're gonna go into what are pads, okay? So pads are, we take a little look at them here. We have some reusable pads here, pictures of reusable pads, where you use and you wash again when you need them. You wash them. So here I'm showing some pictures here. You have some like disposable kinds. These are made of different types of cotton, okay? So in general, look at them, take a good look. There's just different ones that I'm showing you right here. They're rectangular pieces of material, okay? And you stick it to your underwear. These are pads. Rectangular little pieces. You see these little wings, you stick it to your underwear. Some of them have no wings like this, no flaps that you could fold over, all right? And they protect against leaks and stains that you can have. And some are made disposable, like these are disposable, and you use them just one time and you throw them out. Or some of them are made reusable, like these over here, where you use them, they're made from fabric, you use them, then you wash them and you reuse them every month, okay? So they come in very different sizes for light bleeding or for heavy bleeding. So pads can come like really thin for light bleeding or thicker for heavy bleeding. Let's see. This one looks like a thicker pad right here. Okay. And then what you do is you change them every few hours when they're soaked in blood, right? Or when they're soaked in blood. So remember to wrap them in a wrapper or toilet paper, throw them in the trash. Don't flush them because they could clog up the toilets. And also when you have your menses, nobody should know, because you're going to be very discreet. You're going to practice good hygiene. When you're done with your pads, fold them up nicely, wrap them up in toilet paper or the wrapper that they came in, and dispose of them in the trash, not down in the toilet bowls, okay? So we're gonna go on to tampons. You can see here, we have lots of different pictures of tampons. Some have a little bit of an applicator, a plastic applicator. These have no plastic applicators, but all of them have a little string or something that you could pull on that. Excuse me 1 minute. Alrighty. So tampons, they're basically little plugs made of cotton, little plugs made of cotton, and they fit inside your vagina and they soak up the menstrual blood, all right? So some comes with an applicator, and these you just use your finger. You don't use an applicator. This one is a plastic applicator. This is a paper applicator. See? Or you could just use your finger and then you insert it vaginally, okay? And then these little strings, when they're soaked with blood, these are little strings that are hanging out your vagina. You just pull on it gently to remove it, you know, when they're soiled, when they have blood on them. In order to insert it, you're going to wash your hands, get into a comfortable position, and you could either squat or put one leg up on, you know, like a chair or the bed or the toilet or, you know, bathtub, and insert it vaginally. Or you sit on the toilet with your knees apart and push the tampons into your vagina, and it gets into like a really comfortable place, and you don't actually feel it once it is in a comfortable place. You can change these every 4 to 8 hours and by gently pulling on the strings. So we don't recommend that you leave it in for over 8 hours because if left in, there's a risk of toxic shock syndrome, TSS. It's rare infection, but it's dangerous. It can be dangerous. You can get an infection if you left the tampons in too long and forget it, you know. You can get like high fever, diarrhea, sore throat, dizziness, faintness, weakness. And it's really like a bad illness, okay? You don't want to forget it in you. And some people have forgotten their tampons in them. So remember to be careful, okay? Now look at this. This is just like, this is the period panties or period underwear. They look just like regular underwear, but they have extra layer of fabric that absorb the menstrual blood. And you can get them in different sizes. See, there's an underwear, it has like extra layers of fabric that absorbs the blood. And you can wear this on its own or with like, you know, tampons or pads. And if you have a heavy flow, you're going to get the thicker ones. So they have them in light. They have them for light, medium, and heavy flow days. Okay. And then you would wear them on their own and they would absorb blood. And you remember, you have to like change them every so often. But the good thing about these underwear is that you can wash them and re-wear them the following month. Okay. And then you, of course, you're going to have to follow the instructions for washing them. Alrighty. So period panties are another thing that a lot of girls can use these days. All right. And it works so well for a lot of, for people who have light flow. If you have heavy menses, you may want to use a period panty also with a tampon or a pad or something like that, or a menstrual cup. So we're going to go on to menstrual cups. And I'm showing you some pictures here of all kinds of different sizes and shapes and colors. So these are the menstrual cups, different sizes, shapes, and colors, and they have all different names because they're made by different manufacturers. So this, how you use this is that it's like a little bell shaped. You see it has a little bell shaped, and it has like a little stem or a little, you know, plug here that you can grasp when you have to remove it from when you have to remove it when it's soiled. Here's some more. They have smaller ones for teenagers. They have different sizes. Okay, they have different size cups, but they all have different names. Okay, you could see this one is called Nudie, Monthly Cup, Selena, Organic Cup, Kind. You know, you could Lily. You know, it goes on and on. They have the different types of. Hello, like this little yellow one right here. So basically, let's go back to some of the pictures. They're shaped like little bells or bows, right? Look at this, bells or bows. And they're made of rubber, silicone, or soft plastic. And you wear them inside your vagina and it collects the menstrual blood and it's reusable. So what you do is you squeeze it, you know, in, and then you insert it with the cup part facing up towards your vagina because you want to catch the blood in here. When you have to remove it, you pull on the little stem or the little stalk, all right, and then you remove it like that and you wash it out. So most of them are reusable, but some of them they make them where it's just like disposable. So remember, some of them are disposable, meaning you use it for that one menstrual cycle, you throw it away. All right, but you can buy the reusable ones that you could use month after month after month. And you would leave it in for 8 to 12 hours. And to remove it, you're going to remove it by pulling on the little stem like this. So these are all pictures that I have of menstrual cups. They all have different names: Keeper, Moon Cup, Yuki, Lena, Lunette, Diva Cup, Fem Cycle, you know, it goes on and on. But this is also like an economical way to use and reuse for your cycle. Now, there's a lot of things that could go wrong when you're having your menses. And I wanted us to, explore some of those. And I know you may have questions on like when your periods, when things are abnormal. So I could probably stop here, take some questions, and then we could go into like some of the abnormal periods if at this point.
Thank
So
you so much.
yeah.
Yeah, this has been a lot of information, so really appreciate you taking this time. We do have a few questions that have come up. You talked about this a little bit, but maybe you could elaborate a little bit more. When will your period end?
So, your periods usually end. In general, we say an average at about age 50 to 52 years old. So, it goes on for the majority of your life.
Yeah,
Yeah. Yes,
and and then each
there's a
month,
girl with like a very horrified look on her face.
and it's a lot. It's a lot to take in,
Yeah,
definitely,
it's a lot,
right?
but
It's a lot to
some
take in.
people it ends earlier for lots of different reasons. It might end much sooner because they've had a special surgery, to stop it or to remove the uterus. People who are smokers, cigarette smokers, it can end like even in their 40s. But if you're genetically predisposed for it to ending in your like 50s, that's about like the average when it can end. Now remember, nobody is usually textbook, and no, we're created by God, so he has a timing for all of us, but it's usually around our early 50s.
Wonderful, thank you. And then during the cycle itself, each month, how long would it typically last? If you could go over that again.
Yeah, a cycle. Yeah. So when you have your periods, we usually say a week, but some girls, it could be 3 days long, it could be 5 days, 4 days, 7 days long, and some are even 10 days long. Yeah. And sometimes just remember you may be spotting a little bit some days, and other days it might be heavier, and then it goes back to like a spotting. So a lot of times it might last 7 days, but you're not bleeding heavily the whole time.
It can
So
like start and stop
it could
during that
start
time
and
period.
stop. Yeah, it could start slowly, like drip, 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 then like heavy, and then kind of drip, drip, drip towards the end. But it usually we'll say about a week. But you know what? That's why we always insist that you use a calendar, and you can mark the days that your periods come every month, kind of like keep track of that every month. There are great menstrual apps too that you can use to keep track about how long your cycle is.
Wonderful, thank you. Next question, what is a hormone?
Oh, a hormone is a little enzyme in our body that helps us to operate. It triggers lots of different functions. So, for example, I mentioned about 4 different hormones in our bodies. The short names are like FSH, LH, estrogen, and progesterone, and these help trigger our menstrual cycle in women. This helps control us, what we do, our cycles. Now, it's really interesting because men might have a little bit of like estrogen and progesterone in them too, but not to the same degree as women. And we certainly have more estrogen and progesterone and FSH and LH than men. And you might have heard of some other like hormone names for like that men have, like testosterone. They have much more than women do. We have a teeny tiny bit less, we have less than they do, but they do have more. And it's what makes us women, and it is what is make them men. So it's little things that influences our bodies and how it functions.
Right, so it affects how it works, right?
Yeah.
Yeah, okay. Next question, why do you have to push a tampon towards your back?
Well, usually if you're lying on the bed to insert it, it kind of goes towards the back. If you're standing up and inserting a tampon, it kind of goes up, you know. And honestly, it's the shape of our pelvis. When you start to insert it, the direction that the vagina is that day, it will kind of, I mean, the position that you're in, depending on the position you're in, it will sort of like follow that, follow that kind of like position.
Okay, great. Yeah. And maybe there's some of those pictures that you showed of the uterus before. Maybe that would be helpful too for later.
Yeah.
Is there a problem if it does not come when you are a teenager? What if it takes a really long time to come?
So usually by age 15 or 16, if it doesn't come, that's usually when you should go to like a gynecologist. Or, even at that time, if you're seeing your pediatrician, go to your pediatrician and talk to them about it. But by 15 or 16, that is when you should go. But don't worry if it doesn't come when you're 9 or 10 or 11. Remember, it could come at when you're 12, 13, 14. But definitely by 15 or 16, you should go, because there are a lot of tests that we can do to figure out what's going on. And sometimes just by talking to you and figuring out how you eat or what sports you play, it might all make sense. And we might say, oh, it's normal. Just wait a little bit or something.
Yeah. So don't be concerned until.
Don't be concerned until you're much older, about 15 or 16, and then go to the doctor, because we have ultrasounds, we have MRIs, we have blood work, different things that we could do to look into to things.
All right. What do you do if your period is more than 4 to 7 days?
Well, it could last up to 10 days too. So it could be anywhere from 3 to 10 days. So some months, actually, it might be, what if it's 11 days one month? But what if it's 4, 5, 6, 7 days the other months? That is why it's always good to like keep a menstrual kind of like diary, so that you know how long your periods are, what's normal for you. Because if it's 10 days every now and then, or 12 days, you're not so worried. We're not so worried about it. However, if it's about 10 days long and you're bleeding very heavily, like I told you, you're bleeding like 1 to 2 pads, you're soaking it through every single 1 to 2 hours, you're soaking up a pad, and that's going on for 7 days. That's excessive. That's really excessive, and it should be looked into.
So you should really just pay attention to what or find out what your normal is, pay attention to it. And if something starts to become abnormal, then ask a question.
Yeah.
And it could be different from somebody else's normal, right?
That's right. And that's why it's important for you to keep track of your what's normal for you. And then when you go to the doctor, remember to bring that little paper that you've written everything down, or your little menstrual app, because we have to go over what it was like for you, and kind of like just teach you or do further tests if we need to.
Okay, great. What do you do if you are in school and the blood soaks your clothes?
So sometimes this has happened to many, many girls. And when it first happens, it could be very embarrassing. So what you do is you might have to go to your school nurse, and they would help you, clean up and, give you a pad or something to wear. And I know like a lot of schools, they may have extra clothes that you could change into. But a lot of girls, just so you know, they walk with an extra change of clothing, especially if they're not sure, and you walk with extra pads in your bag. If you're not sure when your periods are going to come, walk with extra supplies, extra pads or change of clothing, just in case you have an accident. But if you have an accident, you might have to go to your teacher or your school nurse, but go to an adult that you could trust, and they will help you clean up, tidy up, and change.
And it can be better to wear darker clothes, right?
That's right.
And then lighter.
Just in case, because if you wear darker clothes, that's a good point. If you wear darker clothes and it gets stained, then you would not feel so embarrassed.
Mhm.
Nobody might ever notice.
There you go.
Yeah.
Is there any problem if you do not shed the uterine lining for a long length of time, whether it's from natural causes, period blockers, or hormonal oral pills where the placebo week is skipped?
So when you're taking hormonal stuff, basically when you shed the lining, it's not the normal lining that you're shedding. We call it a withdrawal bleed. So that's kind of like a whole different thing. It's really not even like when you're taking hormones like birth control pills, for example, what happens is it blocks that normal cycle that normally happens in your body. It blocks all those hormones that are doing its thing. So when you stop and you're doing the placebo week, you get a withdrawal bleed, we call it. So it's not like a real um, ovulation type bleed. It's not like your body doing its thing. So the bottom line would be no, it wouldn't. It's not abnormal. Now, and let me just backtrack. When they invented birth control pills back then, they did it on purpose, where the scientists and stuff who invented it, they did it on purpose, where you would have these kind of placebo week where you can have a withdrawal bleed, so everybody think it's normal, but technically it's not. So now that we are more educated about it, a lot of girls are using the extended regimen birth control, where they're getting their periods just about 3 to 4 times a year if they're using pills, because they're realizing that it's really just not necessary. And a lot of girls don't like having their periods every month anyway. So I guess your question is it normal or healthy? It's fine.
Okay, so there's not an issue of
No,
causing
it's
damage
not.
later or something like that.
Nope.
Nope.
No, not at all.
All right. Is a heavy flow a sign of possible fibroids?
Yes,
So
it can be.
someone. Okay, so how would you know?
Well, okay, so fibroids are benign growths. They're benign tumors that could grow on your uterus. So a tumor, when people hear tumor, they think it's a bad thing. But in this case, this tumor, they're not the malignant cancerous type. They are non-malignant. So they can grow. They can be different sizes. They could be the size of like a pea, or the size of an orange, a grapefruit, a watermelon. So these are like huge masses that could grow.
Wow.
And theoretically, when your uterus is expanded that much, what happens is it can create a bigger surface area of lining that needs to be shed. So a lot of these girls have very heavy periods, because you're not just bleeding from a uterus that's 6 to 10 centimeters anymore. You're bleeding from a uterus that might be 16 or 20 centimeters long. Okay, so you might have like a really big. So yes, it could be because of fibroids, but you wouldn't know unless you go to your doctor and have it checked out. So we usually do a pelvic ultrasound. These are like little imaging things that can that will help us diagnose fibroids, and they're very classically seen and diagnosed on ultrasound. So that's basically one of the easiest things that we could diagnose on an ultrasound. Sometimes, even when they do a pelvic exam in the office, you'll notice that they can actually feel like bulkiness or something that might make them suspect it's a fibroid. Especially if they test and they see that you're not pregnant, right? What is this bulky thing in your uterus? And they could start figuring it out, have a good suspicion of what it is.
But if you don't know,
studies,
go ahead.
No, imaging studies like ultrasounds, MRIs, CAT scans will certainly help differentiate. And we have so much experience because they look a certain way on ultrasound and MRI. So fibroids, I mean, they look a certain classic way. So it's very easily diagnosed. Yeah, what were you saying?
No, I was going to say, how would a teenager know that perhaps her period is heavier than it should be, especially if that has been the normal, and they don't find out till they're an adult? Like, how could they kind of be aware of that as a teenager?
Well, for one thing is, you're right, that's a good point, because a lot of girls started out with like very heavy period, like bleeding like 7 to 10 days, for example, bleeding very heavy, but they don't know. They just think that's normal. Sometimes they don't know unless maybe a friend or their mother or aunt or somebody points it out to them. That's not normal. You're bleeding. But sometimes, just so you know, these girls, like if they become anemic, if they're losing too much blood every month, they may become very tired, very lightheaded, dizzy, short of breath. These are some symptoms of anemia. Your body will start to like tell you that something is wrong. So say like you've never known, nobody's ever told you that your periods are heavy and something is wrong. It shouldn't be that heavy. Um, your body will eventually start to like over time get very anemic, and you'll start to feel sick. You'd feel like so tired. You'll notice that when you're walking upstairs. So I've met a lot of girls like that over the years. They didn't know, they just thought heavy period was the norm. So like when they start walking upstairs, they're like, "Oh, something is just different. I'm like short of breath. I'm winded. Something is wrong. I'm dizzy. I'm lightheaded. I'm tired all the time. I'm sleeping all the time." And that might trigger them to go to the doctor. So what if so? But I'm going to tell you right now, if your periods are about 7 to 10 days long, and you're changing your pads every hour or 2 hours, and it's soaking through, and it's for that whole length of time, that's not normal. All right. So that's not normal. But what if they didn't know that? Then their
Mhm.
body is eventually going to start to give out. They start to feel sick. And then when you go to the doctor, they do a little blood test. It's very easy. Or sometimes they go to donate blood at the Red Cross, and they realize they're anemic. But something usually triggers, and sometimes they look very pale, and they just don't look well. And somebody might say something to them, "Hey, you don't look good. Go get yourself checked out."
Yeah,
And
that's helpful.
yeah, go ahead.
I was going to say that's helpful because, someone may not know if it's just the regular normal symptoms of a period where you're fatigued, you're tired, you don't feel well, as opposed to really being an abnormal, illness. Um, your symptoms are really heavy in regards to feeling that way. So
Yep.
it yeah.
And then the
So
thing
that
is, in order to like increase that, your doctor might give you some iron supplements to take. And iron supplements, you need like vitamin C to help it absorb. So iron supplements, which you can get in the pharmacies over the counter. And then of course, eating a lot of iron-rich foods, stuff like, spinach and kale and lots of beans. You can eat animal products too, such as like fish and chicken and beef. Those are usually, and lots of types of beans too. Um, would give you an increased amount of iron.
wonderful.
Yeah.
Can I do normal activities during my period?
Yes, absolutely. So as long as you feel comfortable wearing something of your choice, for example, like tampons or a pad or the menstrual cup, you can swim, you can play if you're involved in sports, like basketball, baseball, swimming, running. You can be involved, any type of sport that you want to, or activity. Dance, even, a lot of ballerinas around that time, they also, continue to dance with their periods.
Does exercise help with the cramps?
Absolutely. So exercise, rest. So that's the other thing. Prevention is better than trying to like cure it afterwards. So
Mm.
if you remain active, leading up to your periods, active, doing whatever form of exercise you like, um, getting proper rest, and eating healthy and avoiding junk, you'll notice that you won't get so many symptoms that I talked about, like the moodiness or the fatigue or, difficulty sleeping. It's all helped with proper rest and exercise. So definitely it will cut down on the amount of cramps. And a lot of people, I mean, that's the cure, go ahead and just lead an active life to cut down.
So that's helpful information, because a lot of times we just hear that this is just the way it is, right? And there's nothing that we can do to help with anything, right?
I know.
And here there's a lot of things that we can do to help mitigate some of what's happening, or to make it less severe, right? How come some months have different symptoms than others?
Well, I guess sometimes it all depends on how busy you are and what things you're doing. I know, for example, let me give you an example. Some girls who are stressed, maybe they have school at that time and they're stressed, they have finals, they have, maybe they're in a bad relationship, they're breaking up with the boyfriend, or maybe they're upset with their friends at school who are girls, or, they're just totally, like, whenever you're physically or mentally stressed, it could affect your health as well. It could affect your physical health. So mental stress could affect your physical health, to the point where even sometimes when you're really stressed mentally, your periods may not come, So even if you're super stressed at school, or it's really difficult semester you're having, sometimes that messes with your periods too. So, and then some months you might be really good about exercising and eating right. So you might not have any kind of, you might feel good, during your period. So just consistency is the key, consistency is the key. But remember that, sometimes if you're eating more junk food right around like Thanksgiving and Christmas and so, you're eating more sweets, some more junk food, you'll notice that things get a little more crampier around menses time. So just remember to start paying attention to your body and how you feel. But thanks, those
So
are great questions. Yeah.
yeah, we have just a few more. They keep coming in.
Sure, absolutely.
It's a very popular topic.
Yeah.
But I was going to comment on that stress can cause it to be late, or to miss it, or to come early, right?
Yeah.
It could just totally
Or to
change.
be real long. Yeah.
Yeah, or to be longer. Yeah. Does the body respond to the side the egg is released from?
Now, do you know most people have their ovulate or really settle egg every month, and they don't know which side it is. But some women do.
Some do.
Some do. They say, no, it's from my right side or the left side. But in general, like the majority of people may not know at all which side it's released from. These things happen so like stealth. So, but some girls, they're very in tune with their body. It's just amazing how some people, sometimes even though you may not know, sometimes even though you may not habitually know which side your egg is released from, sometimes you might feel just more cramping or bloating in the right side or the left side. And you might say, I'm ovulating around that time, especially if you have a little app that's telling you, yeah, you're due to ovulate or whatever. But sometimes it could be just gas. The symptoms are quite similar, when you have like a gas pain or something. Sometimes you don't know.
Yeah,
But
it can be confusing, and the symptoms can be different every month. You may
yeah.
have some things worse one month or less the next month, or different from other girls, other women, right? Or same.
Absolutely.
So
Yeah.
nothing is ever, precise. Heavy periods with a lot of cramping can also be a sign of endometriosis. Can you share some information about that?
Endometriosis is a condition in which women experience a lot of pain. And this pain is thought to be because of the lining that sheds every month. That's called the endometrial lining. Those cells get implanted in different parts of the body, and they don't just always flow out the vagina like they should. Some might go and get implanted by many different mechanisms into the wall of the uterus, on the fallopian tube, on the ovary, inside your abdomen, like on your bowels, your bladder. And then every single month, when the hormones, when it makes those hormones, when the hormones make those endometrial lining grow, the lining that's inside our uterus, to shed every month, well, it affects those cells wherever they may be. So it's a very painful process to girls who experience endometriosis. And it starts manifesting around like in your late teens, like 18, 19, 20, like early 20s. A lot of girls start having like very, very painful periods, which could be due to many, many different reasons. Um, but that's a harder one to diagnose because we usually go through a whole list of thinking it's other things first. But it's so people are so aware of it these days that we diagnose it much earlier. But long ago, it used to be, something that they would think it's all made up, it's all in your head kind of thing, and we
Yeah.
know that that is not true. But endometriosis is a very painful condition that some women have, not all.
So it's important to speak with your doctor if you are concerned about anything that's
Yeah,
happening.
I mean,
That
yeah.
kind of stuff. Yeah.
Keep a menstrual diary, write down how much pain you're having each time. And now remember, it's normal to have some pain or discomfort, like we call them cramping or aches or so. And you can experience this in your lower abdomen area, your lower pelvic. Some people experience it in their lower back. So their menstrual cramps, they experience in their lower back, so always write down the signs, the symptoms that you're having, and be quick to talk to a doctor about it. Sometimes even if it's just for reassurance, hey, these are what my cycles are like. A lot of times you don't know what you don't know, but it's good to just go and talk about your symptoms with a gynecologist or with your primary care doctor or your pediatrician.
Wonderful, wonderful. Thank you. One last question. Should I clean myself differently during a period?
So during your period, no, just with the regular, when you're taking a shower, water is good. What I'd recommend is some girls, if they feel like they have those like little blood clots or tissue clumps coming out, you can use your finger, insert it, and just gently, clean out the vagina that way. Okay, but you don't have to, no douching, no summer's eve sprays or scents or anything like that, but just like regular soap, the soap that you soap your body with. If some gets in the labia area, that's okay, but water is just fine as well. Good hygiene too. Good hygiene. Remember, a lot of times during that time, you may have increased acne, for example. So you want to make sure that you wash your face, gently. Um, there are different things that you could use to prevent acne or to cure it if you do have it. Even something like tea tree oil or putting a little toothpaste on the little acne will help, or baking soda. But there are a lot of things out there um, that you can use. But even washing your body, because you may tend to sweat more and you might have more underarm perspiration and odors in the underarm and the genital area. So it's good to take a shower in the morning and at nights. So definitely just be cognizant of just to be, pay attention to proper hygiene around that time. Every time, but especially around that time. And in terms of changing the pads, remember, they can develop an odor after a while. Make sure you change your pads and use clean, fresh pads each time.
All right. What do you want men and teenage boys to know about the menstrual cycle, or something to destigmatize it?
Well, to know that it's a natural part of what happens, to women. It is nothing for them to make fun of girls, for. And I think, when men are educated, it's the same. They're just aware that it's normal. A lot of times there's a stigma, like you say, around like, oh, she's having a period, she's PMSing again. Meaning a lot of people think they point to like the moodiness or the mood symptoms that some girls may experience. Because you may have physical symptoms of like bloating or, weight gain or, like food cravings, but you can also have mood changes, such as like you feel a little more sad at times, or a little more weepy for no reason, or a little more angry like a ticking time bomb for no reason. But just be understanding. And it's just to be like, if you have your sisters or your cousins or your friends, just to be supportive during that time, and give them space, you know, especially if they're moody or so. But it's just like a natural cycle. It's just a natural cycle, that it's good that you're aware of it, and that it's and that it's happening, and just be supportive of your
But if you're
friends.
feeling those feelings, they don't always happen around your menstrual cycle. Sometimes you can feel that way and not. And so it doesn't always mean that, right?
I know,
So,
but yeah, there's that stigma that, oh, you know, that person is just like mean around
yeah,
this time and stuff, you know. So, but
yeah.
you're right, it can happen at any time.
You can be angry and sad at other times too, not just
Absolutely.
during that
And
time.
you don't just always blame it on their cycles either.
That's right. How can women effectively communicate this to their friends, their boyfriends, their family members?
It takes a lot of like patience and understanding and open communication, especially when they're not going through it, you know. Some women, if you notice that you are more, you know, tired or more cranky or something around that time, it's good to communicate, not just while you're going through it, but when you're not going through it, so that they'll know what to
Mm,
do. Okay. And I think it's especially important to communicate how you feel and what symptoms you might feel when you're going through your periods. When you're not having it, that's the best time, when you have like a clear head, or you know, when you're not so tired or irritable. um, but I think once you, now, just so you know, I'm talking about people who do feel more tired or cranky or so on. Some women don't, and they don't, you know, it doesn't affect them, and you know, their periods come and go, and their partners, you know, husbands, boyfriends may not, you know, brothers, you know, nobody would know. But if you do think that you need a little more understanding, or you know, or people might be reading you the wrong way, you know, or misunderstanding how you're feeling or whatever, open communication is key. Communicate. You could never, you know, have enough. Just be open about it.
and with other women too, because there are some women who do not have the same symptoms or do not have severe symptoms, and they don't understand always why
Yeah.
other women do. And so
Yeah.
it's important across the board
Yeah.
to express that. When the period stops, the questions keep coming. When the period stops, what are some side effects of menopause?
So luckily, for about 8% of women only who head into menopause, their periods just stop. They have no hot flashes, no night sweats, nothing. No
Amen.
irritability, no. But for the rest of the 90, you know, 92% of us people, you know, you can have a lot of, when your periods are before it stops, about, we call it the perimenopause or the pre-menopause phase, which can last anywhere from 2 to 10 years, right? So we're talking about in your 40s, you know, you might notice that your periods, right, they start getting shorter. The cycle lengths start getting shorter. It's something starts changing. Or maybe longer. Instead of every 30 days, it's coming every 45 days now, right? So something starts to change with the length. Sometimes if your periods used to bleed, if you used to have like periods that are lasting 10 days, maybe it might become shorter. It might become every 5 days long or so on. But you'll notice that some things start to change. Or vice versa. If your periods were really short, like every 3 days, maybe it might start coming a little bit longer. Okay. You might notice, some girls might notice some hot flashes, okay, and night sweats. And it seems as though these hot flashes or hot flushes, they're called, you'll notice that you may not be aware of what's going on at first, because all of a sudden you might get a woman might feel like a heat rise up in them. You know, it's just like an oven is open, like they're sticking their head in an oven, and they might feel it, you know, the top part of them, like their face, or maybe their torso, the top, you know, their top part of their body, or maybe all over their body. And usually it's like a thermostat. Our thermostats in our body starts to become a little bit out of whack. So, you get these heat followed by like the body is trying to cool itself down. So you get these cold sweats. It's basically you're sweating in order to like cool yourself down. And it can be like quite a period of consternation for women. It might affect your sleep too. It might affect you might have a little more insomnia, or you might wake up very often in the middle of the night, to throwing the covers on and off, keeping the place really cool, much cooler than people around you would like to have it. It's just like it's sort of like when spring and winter is meeting head on. You get all these different seasonal changes like we've been experiencing. Well, it's kind of like our body starts to go through this season of change where it becomes our periods are different, or some of our symptoms are different. But it's interesting. A lot of women don't know that they're having menstrual, like menopausal or premenopausal symptoms, though. So they might start feeling this hot and anxious. Their heart might start beating rapidly. They might get nervous, actually. They might get very anxious about the whole thing, not knowing that they're entering menopause or perimenopause.
So this is actually a question that just popped up. Is irritability, anxiety, and depression also associated with
it can really affect their moods as well with depression. But and that's a lot of times, they go to their doctors, the same, to talk about their symptoms and to help navigate that time, because there's a lot of things we do to help them. But remember, you are not considered menopausal until you've gone 12 consecutive months without a period. No hormones. You're just like, this is your own body, 12 consecutive months. So if you start skipping months and it starts coming every 3 months, every 6 months, every 9 months, right? So you're not menopausal yet. When it's gone 12 consecutive months and you haven't had your menses, then you consider yourself menopausal. But during that transition, you consider yourself premenopausal or perimenopausal.
Does norethindrone help with hot flashes?
Norethindrone is a progesterone type pill that we could take, and yes, that we prescribe. It helps somewhat with hot flashes. The other things, we have lots of other things that help too with hot flashes, and that's one of it. There's there's like estrogen pill, progesterone, and you if you're going to take something like estrogen hormonal, you have to, and you have a uterus, you have to remember to take progesterone, because just by taking estrogen alone and not taking like progesterone to counterbalance it, it can cause uterine cancer if you do that. But remember, hormones should always be taken and monitored by a doctor. There are other things over the counter that people use as they go through the menopausal transition. Things like chaste tree berry or black cohosh. Even things like there's some SSRIs, there's some even depression medicines like Effexor we use for hot flashes. Yeah, believe it or not, it's not for, it's like for depression, and we use it for hot flashes, and it actually helps. So even things like eating, lots of maybe complex carbs like yams, or, even, doing the same, exercising, healthy sleep habits, and so on. It helps mitigate those symptoms of menopausal transition.
How about Isorel?
I'm sorry?
Isorel?
Isorel? I'm sorry.
You haven't heard it? You haven't heard it? Okay, I guess that's another medication.
Okay.
Yeah.
Isorel. How do you spell that?
Isorel.
Okay. Is that something over the counter?
Yes.
Yeah, Isorel. I wonder what's in it. Let me look that up.
This is another question that came in. So.
Yeah, Isorel. Well, there's a lot of supplements, but I'm looking it up right now, and it looks as though it has what is in it? But Isorel, anyway, but you have to not look at the brand name, you have to kind of look at what's in it.
Okay.
So Isorel, soybean, I'm thinking it's saying soybean in this one that I'm looking up. Yeah, this one has the one that I'm looking up, soy, it says soy. And yeah, so that's another thing that people use. Now remember, soy can affect the estrogen receptors too. So, be careful of how much soy you intake, or if someone has had breast cancer or uterine cancer, you may not want to take certain types of soy products.
Yes.
But yeah, but Isorel, Estroven, by the way, that's a brand name product, but Estroven has black cohosh in it and a bunch of other vitamins. So
Yeah.
when we're talking about supplements, we just, we talk about like for example, black cohosh, which can affect the estrogen receptors too.
Can that help with cramps also? Like during your period, black cohosh?
I'm not sure if it will help with cramps. I know evening primrose oil helps with cramps as well. The evening primrose oil can help with cramps. So,
so going back to the periods, is there a difference? What's the difference between a very red flow and a dark black thick flow?
it all depends on like the time of the cycle. So sometimes it's the darker one or the browner ones occur towards the end, or sometimes towards the beginning, or it depends on if you have hormones on board. So if you have like the Mirena IUD or birth control pills, something hormonal, it can actually change the color of the flow. It could come out like thicker, like dark, like coffee grounds, or and that's all normal, by the way. That's all normal. It could also come out bright red. That's fine, or it could come out in like little clots. So I know towards the end, you start paying attention towards the end, you'll notice that your period come out like brown, or light brown or darker brown, and kind of fades off, and that way.
Well,
But yes,
this
it can
is
have
really,
different colors.
yeah, this is really helpful because, especially for somebody who's going to experience it for the first time, there's a lot of different things that can happen, and you don't know what's normal and what's not normal. And so this has been really helpful. And I think the questions have slowed down. But I believe you wanted to finish your presentation. You had a few more slides.
Well, it was just about like things that could go wrong, and I think they've
covered it.
Yeah, we've asked a lot of those, because there's a lot of things that that have come up. Of course, what interrupts your periods? Pregnancy. A lot of times, if a person gets pregnant, right, you won't have your period anymore. You do hear like stories about people who continue to have their period while they're pregnant, but that's very, very rare. Okay, but there are girls who have things like polycystic ovarian syndrome, who might have periods that are different. It doesn't follow the rule book. There are girls who have all kinds of like hormonal malfunctions, where the estrogen progesterone ratio is not quite the way it should be to trigger a normal to a normal period. So anything that is kind of like abnormal or troubling or concerning, you remember, you keep your menstrual app, you write things down, and you always check with your doctor. And don't compare yourself to anyone else, because everyone has a different type of cycle flow.
That's wonderful. That's a great summary. Really appreciate your time. This was a very popular topic, as you can see. So we want to thank everybody for coming, for listening in, if you're listening later. And we want to invite everyone to come back next Tuesday with the doctor, which is on April 25th at 6:30 p.m. with Dr. Raquel Allen, who will share information on pediatric care. So other information can be found at our website, as well as other Tuesdays with the doctors. Thank you so much for being with us tonight.
Well, thank you very much for having me.